Hello, my name is Felicia Gualin. I'm a physician associate and I work with Westmoreland Group Practice. So physician associates are trained in a medical model. We are part of a healthcare team. We look after patients. So what can physician associate do? Before I go into that, how long a physician associate been in the UK? So a lot of people don't know who physician associates are. So physician associates have been existent in the UK for the past 10 to 15 years, but it's been the USA for over 140 years. And like I said, we are trained in a medical model to diagnose, to manage both acute and long-term conditions. We can do referrals to secondary care. We discuss blood test results or any investigation with patients. We promote health. We do health promotion with patients as well. So what do I do at Westmoreland? I see lots of patients, from babies, pregnant women, from young, old, teenagers with different type of symptoms. I will give you an example of some patients I've seen. So I've seen a middle-aged woman with background of type 2 diabetic, and she's presenting with pains and needles, numbness on both hands and feet. So I discussed what can be the cause. And because this patient has been on metformin for a long time, so we need to do blood tests to rule out any B12 deficiency. Because sometimes people who have been taking metformin for a long time can have B12 or folate deficiency. So we send them out for blood test result. The result is back. We discuss the results with them. We manage them if they need medication for B12. We do that through the supervising doctor, and then we advise them on how to manage their blood sugar or cholesterol, and that is with lifestyle modification like regular exercise, less trans fat food like cheese, butter. And we, like I said, we give them medication through a supervising doctors, and we manage them. We ask them to come back in 3 months time to check how they're doing. If we need to repeat the test again, we repeat the test. And also I have seen cases of people coming in with sore throat. Those are acute, and then you look at the throat, you diagnose them if they need medication. We do that through a doctor. If it's just a viral infection, we advise them that they don't need antibiotics and it's safe limitation, which we resolve. But that doesn't mean that is the end. With physician associates, we like continuity of care. If they say having symptoms, they can come back. We can have a look at it, because viral infection can change to bacterial infection. If they don't see any clinicians, they might not be able to know. Like I said, we examine patients if they have any breast lump or they putting on weight or they losing weight. If we need to send them to hospital, secondary care for further investigation, we do that. Maybe a case of someone coming in with breast, lump or breast pain. We do 2-week urgent referral just to rule out breast cancer. We follow them up even after they've been seen at the hospital. We make sure we check on them to make sure everything is fine. With kids, so we see all different types of symptoms or diagnosis. Physician associates will run our home clinics. If you want to diabetic clinics, we do that. Physician associate can run diabetic clinic. We've seen so many physician associates working in secondary care, in A&E. They become menopause specialists. They are into dermatology, minor surgery. So physician associates, they are also found in mental health, managing people with depression or any mental health disorder. Yeah, that is what we physician associates can do, and we are safe practitioner. We know when to ask for advice. We know clinical advice, and that makes us a safe practitioner.